If anyone is joining late, please help them out with the topic name, immunity and infection. So, what is immunity? Immunity refers to your body's ability to prevent any invasion of pathogens. Okay, pathogens are any foreign particles or foreign bodies, substances they that have the potential to cause infection in you. Okay, like bacteria, virus, fungi, protozoa. Okay, these all come under pathogens. And as humans, people, we are exposed to these pathogens on a day-to-day basis. But not all the bacteria or viruses that you're exposed to on a daily basis can cause you disease. Okay, that's because your immunity is working to keep you healthy, keep your organ cells and proteins healthy. Okay, so why don't you catch infections on a daily basis, even though you are exposed to them on a daily basis? It's because your immune system is actively functioning. So coming to the types of immunity, there are two major types of immunity: innate immunity, acquired immunity, or adaptive immunity. These are the other names for it. Okay, innate immunity or natural immunity, you're born with it. Adaptive immunity, you adapt to you adapt this immunity as you face challenges with infection. Okay, since the birth, when you are exposed to certain viruses and bacteria, in those challenging conditions, your immunity adapts to fight for itself. That is adaptive immunity. Innate immunity is the one that you are born with. Naturally, it will exist in a normal, healthy human being. Okay. So under adaptive immunity, you have natural and artificial. Okay. That naturally that is given to you, and artificially that can be given to you. We'll see it in detail in the further slides. So in innate immunity, it is a general protection that a person is born with, including some physical barriers, skin, body hair. Okay, you are born with your skin. You're born with mucous membrane, mucus producing cells. Okay, you're born with white blood cells, T lymphocytes, B lymphocytes. These are produced in your body in a natural way. Okay, they all become part of your innate immunity. Okay, all the defense mechanisms that you have in your body in the form of saliva, gastric acid, hydrochloric acid. Okay, everyone is born with these things. A healthy, normal human being is born with these things. Okay, your inflammation is also an immune response. Okay, something that has attacked your body goes into a state of inflammation in response to that attacking pathogen. Okay, and they are non-specific. They don't know and they don't care if it is bacteria, virus, fungi, protozoa, dust, or any toxins. They don't care about it. The mechanism of action is the same for all the different pathogens. The way how they will trap bacteria is the same way how they will trap a virus, protozoa, dust, etc. They are non-specific. Okay, this is what we call as non-specific immunity. Okay, they just have one method of action and it applies to all different types of pathogen. Although the immune system does not know exactly what kind of antigen is invading the body, it can still respond very quickly to defend you against any pathogen. So that is its non-specificity. Okay, they don't care what is attacking. They just know to tackle the attack. Okay, and this is a long-term immunity in which your body will produce antibodies on its own. Okay. So immune system, we have innate immune response, adaptive immune response. So in innate, cells are Non-specific adaptive immunity, we will see later. Cells are non-specific. It has one way of action to kill all the bacteria, and it is quick. Okay, within few minutes or within few hours, it will go into its action mode. Okay, and there is no memory. Okay, it will not try to remember. Okay, last week this bacteria has attacked. We took these many hours to tackle it. This week again this bacteria has arrived. Okay, and we have to use the same technique. So it does not have that memory. Okay, it is like shoot at sight kind of a situation, and it is in a default. Always it is in its default settings of shoot at sight. Does not it does not bother how many times it has shot. Okay, how many times it has been attacked, does not remember. Okay, that is no memory, but your adaptive immunity will have memory. For example, chicken pox. Once you get chicken pox, your body, you heal from chicken pox, your body has a memory of it. Again, chicken pox, so virus will not attack you again. Okay, even if it attacks, your body would have the memory of it, how to, which antibodies to use to tackle this situation. Okay, to tackle varicella zoster. Okay, so that is a memory of the immunity, but in innate immunity, there is no memory as such. Okay, always it is the same response that is given. Then here in innate immunity, these are the cells that are always working. Okay, these are in your red blood cells, etc. Okay, sorry, or your white blood cells, your blood cells. Okay, lymphocytes. So we have monocyte, macrophage, natural killer cells, neutrophil. Neutrophil is a type of your of WBC, white blood cells. Okay, eosinophil, neutrophil, basophil. Okay, these are types of uh, white blood cells. Okay, monocyte, macrophage, natural killer cell, dendritic cell is found in your central nervous system. Okay, this dendritic cells will take care of any invasions in your central nervous system, brain and spinal cord. Okay, mast cells. So these are various types of cells who actively protect your body against infections. You are born with these cells. Okay. Natural killer T cell works both in innate immunity as well as adaptive immunity. So the types of barriers are also innate immunity. Okay, you're born with it. So there are four types of barriers. Physical barrier, this is your skin, your body hair, cilia, eyelashes. Okay, in respiratory tract, mucus in the respiratory tract, GI tract. Okay, everyone is born with this. So this is the first line of defense in your body. If you can imagine, if you didn't had the your skin, all your organs would have been exposed to the outside world. Okay, so skin is also a protective barrier, natural barrier, and it is a part of your innate immunity. The mucus coating in your nose, okay, ear, okay, these all are protective barriers which can trap the pathogen before it gets inside. Then we have physiological barriers, saliva in your mouth, tears in your eyes, Okay. They all have antibiotic property. Saliva has enzymes that are antibiotic in nature, and they don't allow the growth of pathogens. Even though if you're exposed to these pathogens on a daily basis or throughout the day, your saliva and the tears in your eyes can protect these organs. Okay. So they are physiological barriers. Then cellular barriers, cells like white blood cells, neutrophils, lymphocytes, basophils, eosinophils, monocytes. Okay, these are the 5 types of white blood cells. Okay, these cells are present in your blood and tissues. At a cellular level, they will give you protection. Okay, they secrete certain these neutrophils, basophil, eosinophil. They have toxins within them that will burst open when they trap the bacteria or virus, and these toxins can kill them. Then we have cytokine barrier, especially in case of viral invasion. When a virus is affecting you, automatically your cells will produce these proteins called interferons, and they will form a coating around the infected cell in such a way that this infected cell will undergo the damage, it will undergo autopsis, but it has to prevent the spread of virus from one cell to another cell. So that's why the interferon coating will be created. Okay, just one cell who is infected, it will be covered, coated by interferons in such a way that the virus will not get out of the cell to harm other new cells. So that was about different types of barriers. You are born with this, so it's a part of your innate immunity. Coming to the cells that are involved in innate immunity, you have phagocytes. Phagocytes, they swallow the bacteria or they just engulf, okay, the bacteria, virus, dust, okay. And once they have engulfed these pathogens within themselves, that's when they will release the lysosome that which will kill the bacteria. So phagocytes, they circulate throughout the body and they are always in search for any foreign substance. As soon as they come in contact with the foreign substance, they will engulf it, swallow it, and completely destroy it within themselves. Okay, and that's how it protects you. Macrophages, again, they have the ability to move out of the circulatory system. Okay, macrophages are supposed to be inside your blood, but as soon as they sense some invasion has taken place outside the blood in any cell, okay, it has the capability to move out of the circulation. Okay, the circulation of the lumen, if you know, it is arteries and veins. Okay, pretty strong, but when they thin down into capillaries, it is more permeable. Okay, so monocytes have the capacity to move out of the circulatory system and directly go to the cell which has been infected, release cytokines so that other cells, other immunity cells will be alarmed to come to this site and then do their job. Okay. Mast cells, yeah, they are usually important for healing and defending your body once you are down with a wound or something. Okay. Mast cell will be more active. So those who are undergoing some wound dressing or those who are burns patients, if you check their blood report, mast cells levels will be high, indicating that the wound is healing, it is trying to protect itself through infection. The neutrophils, these contain granules that are toxic in nature, okay, and they kill any pathogen that comes in contact. You can see here in neutrophil. Small granules are there, basophil, eosinophil, neutrophil, small grains and granules are there, which means they have to keep searching for a foreign particle, identify it, engulf it, and release the chemical to kill them. Eosinophils, they are also highly toxic in nature. The proteins that eosinophils have, which can kill any bacteria or even parasite which comes in contact. Usually, when you are undergoing allergic reactions and all, allergic inflammation is all there, your eosinophil levels will be quite high. Then you have basophil. They attack the multicellular parasites like mast cells. These release histamine. Eosinophil, neutrophil, and all, they can fight with single-celled organism like a bacteria, virus, and all. Basophil can attack even multicellular organisms like any hookworm, tapeworm. Okay, they are sitting in your intestine. Your basophils can still try to attack it. Then we have natural killer cells. They stop the spread of infection by destroying the infected host cell. Okay, just like how interferons work. Okay, once the bacteria has invaded a particular organ, if the person has mm, any form of infection that has been taken place, even in single cell, okay, just by the process of apoptosis. Apoptosis means cell suicide. Okay, cells will kill each other, kill themselves. If it is infected, cells will kill themselves so that it is not spreading the infection. Then dendritic cells, they are located in your, usually in your central nervous system. Okay, they will directly send an sense that there is an infection or a bacteria that has arrived at the central nervous system, and they will send a message through chemicals to the rest of the immune system that a new pathogen has entered. What would be the medications used, or what would be the antibodies that has to be produced. So far, is it clear to all? Now coming to acquired immunity, which you acquire as you progress in life. Okay. So it is an immunity that your body acquires or gains over time, and it is not present by birth. The ability of the immune system to adapt itself to disease and to generate pathogen specific immunity is what we call as acquired immunity. Okay, the antibodies which are made here are pathogen specific. Okay, uh, the antibodies that your body has made for hepatitis will not work for rubella, will not work for polio. Okay, so it is specific, pathogen specific. It will identify who and what, and according to that it will create the antibody. Okay, and then these antibodies will remain in your body. Okay, will be in your circulation until you are exposed to the same infection again. So your body starts producing antibodies to engulf the pathogen and destroy its antigen. The same procedure is used here to swallow up the pathogen. So when it encounters for the first time, when your body or your innate acquired immunity and encounters a pathogen for the first time, that is what we call as primary response. Okay, and once your body is getting used to these pathogens, antibodies are already kept ready in your body to attack them. Okay, coming to the features of acquired immunity, how acquired immunity is different from innate immunity. So it has a specificity, ability to differentiate between different types of pathogens, if they are harmful or not. Okay. Devise way to destroy them. So they have to identify, is it a good bacteria, bad bacteria? Okay. And if it is a bad bacteria, identify, you have to mark it. Okay. Your innate immunity will make antibiotic specific uh, markers, and they will tackle the attack. Diversity, detect vast varieties of pathogens ranging from protozoa to virus. It is not narrow. Okay, features of acquired immunity, it's not narrow. Then differentiate between self and non-self. That is another feature of acquired immunity. It can identify its own cells from foreign cells. Okay, if it does not identify its own cells from foreign cells, that is when autoimmune disorders and all will strike. Your own body is attacking your own cells. Then memory, once the pathogen has been encountered, or once the innate immunity has met the pathogen, okay, it will activate the immune system. Here, B cells, T cells, cytokines, they all will be working. And it also remembers the same system which has to start working when after few years the person has same kind of disease condition. So cells involved in acquired immunity, you have beta cells and uh, T cells, okay, B lymphocytes and T lymphocytes. B lymphocytes will attack outside the cells, not within cells usually, but T lymphocytes are the one who attacks the infected cells, and usually they stay within the human circulation. So about the B cells, okay, how did the name came from? B cell and T cells. B cells came from bone marrow. T cells, they come from thymus gland. Okay. So B cells, these are lymphocytes, B lymphocytes, T lymphocytes. B lymphocytes, they are developed in bone marrow. Okay. And once they are mature, they are released into the bloodstream. So these cells get activated on the encounter with any pathogen, any bacteria or virus that has entered your body. Immediately, B cells get activated. Okay, they immediately differentiate themselves into either plasma cells, which can produce antibodies. Okay, so plasma cells will go and see the presentation of the virus or bacteria. Okay, how it looks like. For example, if you have to fight someone, okay, you are going for an MMA watch or some match or something like that, or even a street fight or something. Can you blindly go out and fight, or would you like to see the opponent, whoever you are fighting? Just imagine you are in a situation, you are going to get into a situation of a street fight or a wrestling, boxing, okay, any contact fight, okay, MMA. Yeah, you would want to see the opponent first. You have to judge. Will you be able to beat your opponent? Okay. Do you have any chance against the opponent? Right? You have to see the opponent first. You have to see the presentation. What is their score? What are they? Okay. What are their height, weight, and like their skills? You have to study that. So B lymphocytes also do that. They go and they have to see the opponent. They have to see the pathogen. So accordingly, they can come prepared with the specific type of antibodies. Okay. That is what B lymphocytes do. So as soon as they understand, they get the message that, okay, there is a foreign particle, a pathogen. They will immediately shift themselves into plasma cells, which can produce antibodies. Okay, they will go and see the opponent, study their features, and make antibodies specific to that pathogen. Okay, or specific to that antigen. Here antibodies are produced, so we will call the pathogen as an antigen. And these antibodies, it will attach to the surface of the antigen or foreign agent. Okay. And once they get perfectly attached to the foreign agent's uh, exposed space, okay, it will destroy it slowly. And this is called the B cell humoral immunity. Okay. Coming to T cells. T cells are, they are produced by the bone marrow and they develop in the thymus gland. Only till once your childhood is over by the age of 9 and 10, okay, thymus glands will not grow further. It will shrink. It will stop producing B lymphocytes, T lymphocytes, etc. Okay. So T lymphocytes, they are produced in bone marrow. They mature in develop in thymus gland. T lymphocytes, they will convert themselves into helper T cells, cytotoxic cells. Okay, what is the meaning of cytotoxic? Cytotoxic. Anyone? B cells will convert themselves into plasma cells. T cells will convert themselves into helper T cells, cytotoxic cells. Cytotoxic means cyto, cell, toxic, toxic to cells. Okay. Which cells they are toxic to? They are toxic to the pathogens and they are toxic to the infected cells. Okay. And they become regulatory cells as well to convert the chaos of infection to something normal. And they are released directly into the bloodstream from the thymus gland. Okay. And when these cells get triggered by any antigen, they can release cytokines that can act as messengers. Cytokines will go and bring other help from all the direction to where infection has been caused. Cytokines are kind of toxins, okay? Cytokines can also initiate the differentiation of B cells into plasma cells. You can see here B cells, they convert themselves into plasma cells. Okay. So how does it convert itself to plasma cells? It is because of the cytokines, okay, that is produced by cells. It can convert itself into plasma cells. And cytotoxic T cells can also kill cancer cells, your own body. It does not require usually something external. Maybe because of internal causes itself, uh, cytokines can damage your own body. Okay, and, it can keep a track on how many cells are normal, how many cells are abnormal, how many cells are cancerous. Regulatory T cells can regulate your immune reactions, like not having an autoimmune disease or any flare up, inflammatory flare ups. To control that, T cells can regulate your immune action. Those people who have autoimmune disease and all, T cells are not working properly in that. Okay. Then you have two types of acquired immune response. Response means types of immunity is different from response. Okay, immunity is the type of foundation you have. Okay, but how will this foundation work? Though that's the response. Okay, there are two different types of immunity response, immune response: humoral immune response and cell mediated immune response. Okay, humoral response we'll see here. See, a B cell got triggered as soon as it had seen an antigen. Okay, this is a B cell, and this yellow flower like situation that you see, yellow flower, consider this as an antigen. So a bacteria or a virus. Okay, so your B cell has identified, it is triggered now because in the blood circulation it identified a antigen. Okay, now the B cell is learning the antigen. The B cell will see this antigen. Okay, it has to engulf the antigen first. It has to bring the antigen within itself, inside itself, to study this antigen, to see what it is about. So that a single virus will not enter your body. Usually they enter in groups. Bacteria also, colony of bacteria may enter your body, or even if it's a single bacteria that has entered your body, they will multiply. Even if it is a single virus that has entered your body, they will start making copies. Okay. So out of these copies, one copy came into the encounter of B cell. The B cell will take that copy inside itself to see, break it and learn what it is about. How should I prepare to fight this antigen, right? In the third step, you can see it is this antigen is completely inside the B cell, but it is broken into pieces because now the B cell has destroyed it into pieces, okay, to study its fragmentation. So according to its fragmentation, it can create an antibody. Okay, now the B cell is well versed with the fragmentation, with the pieces of the antigen, that it is readily creating antibodies. Okay, and then it also attracts the B cells once it has studied this pattern and fragmentation of the pathogen. It will go and give message to the T cells to come and help it to tackle this pathogen. Okay, so helper T cells and B cells both will together release the antibodies. Okay, because and to for the cytokines or the antibodies to be secreted or to be released, helper T cells and B cells have to come together. Okay, you can see here, this is a B cell and a helper T cell also came together in their union. These antibodies have been secreted. These yellow bodies that you see, that has been secreted out. Okay, and they are released into the blood. And these antibodies will go and find out the pathogens and they will attack them. Cell-mediated immune response, this was the humoral response that we have seen. Cell-mediated, it is initiated by helper T cells. There in humoral, it was initiated by B cells. Okay, here it is initiated by helper T cells. And helper T cells are cytotoxic in nature. They are not that good for the healthy cells. They will destroy, damage, okay, the healthy cells. They're cytotoxic in nature. So cytotoxic T cells eliminate the infected cells from the body by releasing toxins. And thus they are promoting apoptosis. Apoptosis is cell suicide. Whichever cell is infected, okay? Because To study the virus, to study the bacteria, it will take some hours, okay, for your body to come fully prepared to fight. Okay. So within those hours, some cells may get completely infected. Okay. And it is no longer useful or viable for the organization. In that case, that particular sector could be eliminated. So that's the difference between cellular response and humoral response. So humoral response is completely based on toxicity of the T cells. Okay. Humoral response is about breaking down the antigen, studying its pattern, studying its fragments, then creating antibodies that are specific to this antigen. Okay. So in acquired immunity, if you see the classification, there is active immunity and passive immunity. Active immunity, it happens in response to vaccination or in infection as well. Okay. You get an infection or you are taking some vaccine immediately. So when you are meeting with an infection, that is a natural way of your body to learn. Okay. But when you are injecting yourself with vaccines, that is an artificial way of your body to make antibodies. Both are right, both are required. Okay, vaccines are also required for the society in general. So coming to passive immunity, again, natural, artificial, passive, it is passed on to you by somebody else. Okay, natural way of passing the immunity is breastfeeding. Okay, through milk, breast milk. When the mother feeds the child breast milk, through the breast milk, naturally the child will get antibodies from the mother. So mother is passing down their antibodies to the child. Okay. In artificial, pre-prepared antibodies in the lab, okay, synthetically prepared antibodies in the lab, those are given to the patients who require it. Okay. So it's not a natural way. The lab, it's not that the natural antibodies are better than the artificial. It's not like that. Okay. That there is a limitation to specific antibodies that a child will get from mother's breast milk. All the other antibodies that the mother herself may not have, but if in the future, if the child may get certain diseases, these specific antibodies are present. It is synthetically made outside the human body, okay, which are safe for use. So those are artificial passive immunity. And autoimmunity, your own system attacks your own immunity attacks your own organs or systems. Sometimes the immune system attacks its own tissues, organs instead of foreign agents. That is called autoimmunity. Okay. For example, type 1 diabetes is an example of autoimmune disease. They will not understand that this person is within the within the healthy range of human body or not. Okay, that specific area will be blurred out. So that's how you get autoimmune diseases. So vaccines, what are vaccines? They are made up of antigens. Okay, live attenuated bacteria, viruses are given in vaccination. So here, deliberately half killed or semi-killed or completely killed viruses are given, attenuated viruses are given, so that the body can make its own antibodies. So vaccine, pathogenic microbes, vaccinating pathogenic microbes in our body deliberately, because you go to the hospital and get vaccination. You know that you are injecting uh, bacteria, potential bacteria or viruses inside your body, just to make sure that your body knows how to respond when in future you encounter the same disease condition. So immunization is a process of providing resistance to pathogenic microbes. Vaccination has come a long way. Lot many diseases we have eliminated, like smallpox. Okay, many countries have eliminated polio successfully because of vaccination. Okay. So in India, polio vaccination are still going on, but we have successfully eliminated majority of the cases of polio from happening. So immune organs, you just have to know the names of it. Okay, there are three tiers of immune organs. The immune system. Okay, lymphoid organs. Whenever you get infection in certain areas of the body, you get swelling in these lymph nodes. Okay, you have in your cell, in near your jaw. Okay, that your tonsils are also a lymph node. Okay, thymus gland is a lymph node. In your under your arms, you have lymph nodes. Peyer's patches in your intestine, okay, lymph nodes in your groin region. So they all are part of the lymphoid organs spread across the body. So wherever infection happens, lymphocytes from these lymph organs will get immediately released into the blood, and they will reach the area wherever infection is there. So the organs involved in defending the body against invading pathogens, causing infection or spread of any tumors, etc. We call them as lymphoid organs. So the bone marrow is also part of this system. Bone marrow, your blood vessels. You have specific lymphatic vessels as well. Okay. So bone marrow, blood vessels, lymphatic blood vessels, thymus gland, spleen. Okay, and all the major clusters of lymph nodes are present in this, in this system. And the highest percentage of lymphocytes are present in white blood cells as leukocytes. Okay, the name for white blood cells is leukocyte. Monocyte and all are different types of lymph nodes. Leukocytes, monocytes. So we can divide the lymphatic system into three tiers: primary, secondary, tertiary. So the primary tier is where the lymphocytes are produced and they are allowed to mature before they are released into the bloodstream. Okay. So the organs are like thymus, bone marrow, spleen. Okay. They are kind of the organs where lymphocytes are produced. Secondary lymphoid organs, these are involved in promoting the sites for the interaction of lymphocytes, like your appendix, Peyer's patches, tonsils, spleen. Okay, they are examples of secondary lymphoid organs. So these are the areas where majority of the fight and the interaction of any invading bacteria or virus and the lymphocytes will take place. Okay, so these are the areas where usually when you are in you have infection, they get swollen. Okay, you have sore throat and all. You have swollen or inflamed tonsils because right now some infection along with the fight with the lymphocyte is happening. That's why you have that sore throat. Okay. Tertiary lymphoid organ. So they have very less number of lymphocytes. And usually they have an important role to play during an inflammatory process. Okay, and usually you find them near the groin region, where there are and also in the throat region, in your intestine, Peyer's patches and all, they come under tertiary lymphoid organ, because these are the areas where tumors and cancers can happen. Okay, in those areas, we need tertiary level lymphoid organs. So that's about immunity. If you have any queries, you can mention in the chat box. This was a detailed class regarding immunity. In exam, this much read